Welcome to part 3. This is going to be your mobility and stretching exercises for your postpartum recovery. And just to recap, like I said in the first video, if you are a C-section mama, you need to make sure that you're getting clearance to start movement. This is early movement. This isn't returning to the gym. What you want to ask for is, may I start some gentle breathing, gentle core activation, and mobility stretching. Okay, we're not going full blown in the gym with weights and resistance, but you need the okay. As far as my vaginal delivery mamas, you need to be checking in with your body. Are you ready for this? Make sure you're not pushing yourself. These exercises and stretches, number one, should not be painful. They should be felt, but not painful. So making sure you're modifying intensity. Anything that is not comfortable, you maybe need to skip and come back to it the next week. I like a full rest for 2 weeks. That's why I recommend starting these exercises at week 3. At week 2, start doing your hot mom walks. And prior to that, you need to be just focusing on feeding your body, bonding with baby. There's really no rush to these exercises. I know the whole internet is like, hurry, hurry, hurry and get it. But by front loading that rest and that bonding, you are going to bring yourself more forward into your recovery. And you get to capture those moments rather than trying to be so worried to getting to exercises. If you are just getting to these exercises at 6 weeks, at 8 weeks, perfectly fine. You're doing great, and clap for yourself. So I'm going to take you through my most favorite postpartum routine for stretching. Again, modify intensity. I am 8 months postpartum showing you these exercises. When I was 2 weeks, things were moving very differently. So skip things that just aren't feeling good. Don't go as far into the motion. Make sure you are breathing. That's the most important part of stretching, is again, getting back to that breath. If you have forgotten you need a refresher on your diaphragmatic breathing, head back to video 1 and refresh with me.
You're going to start with a hand till rock. You're on hands and knees position, and very gently you're going to sit your hips back to your heels. Only go as far as you can. I want you to sync your breath with this movement. You're going to exhale as you sit back, and then inhale as you come back forward. Make sure you're only going as far as you are comfortable. If you need to bring those knees a little bit wider, give yourself that space. Now we're coming into a windshield wiper stretch. It's like a modified pigeon. If you feel really good and you want to go into pigeon, go ahead. For a C-section mamas, this is going to be quite a bit down the road. So just stick into your modified pigeon, opening those hips, make sure you're breathing, and then you're going to flex over to the other side. Use your hands to walk you over and support as much as you need. As you get stronger, you'll be able to go back and forth without much support from the hands. Again, breathing in, breathing out. It's just nice and slow. We're going to do 3 to each side, which is pretty much our rep screen with all of our stretches and mobility. Come into your butterfly stretch, really opening that pelvic floor. Let everything really relax. As you breathe in, open up even more. You can also put your hands on your chest to really focus on your breathing if you need to. Nice. Next, we're going to move into our half nail stretch. I like to use some support to get myself down. So using your bed, something that's stable. You want to align so that you feel your hip and your knee and your shoulder all in alignment. You don't want to be leaning overly forward, and you want to feel that stretch through that front of the hip. And again, you're just breathing into here. Again, alignment there. You can really see on this side. You should feel that stretch through the front of the hip. You don't need to be leaning forward to get that stretch in the hip, because we want to get down into the deep hip muscles, not just the quad. And again, you're just breathing. Next, we're going to move into the adductor stretch. This may be a little bit too much for you, especially if you're a C-section mom. You may just want to get in the position and hold versus sitting back and just getting comfortable there. Your butterfly stretch is going to do a similar stretch there, but I really like this one to just get back and deep into those muscles. Switch to the other side. Again, we're doing 3 on each side. Go to tolerance. Make sure you're cueing your breathing, exhaling as you're sitting back. Inhaling as you come forward. Seated upper body butterfly stretch. This is one that you can do anywhere, anytime. So great for those tight shoulders we get from holding baby, feeding baby, nursing baby, sleeping next to baby. Now here is where the seated and upright stretches end. From here, we're gonna get on hands and knees. So if you are ready to join me, let's go. This is gonna be your thread the needle. Be very mindful as you come into the second half and stretch up toward the ceiling. You are reaching through the needle and then pulling the thread out. You're gonna do 3 on each side. You should feel the stretch through that upper back. And just go slow. Those first couple weeks, you're not gonna get very far into the rotation. Like I said, especially if you're a C-section mama, you may just be doing the front half of this where you're reaching through. It should feel really, really good on those tight upper backs. Syncing with your breath, just in and out. Don't overthink it. And here, this is my favorite stretch to do in the mornings. It is a thoracic rotation, but we're gonna have the arm in a butterfly position. You wanna make sure the lower body, see how my knees are tucked up really high so that that low back is not getting the rotation. It's coming more through the shoulders and thoracic spine. It feels so good. We're gonna do 3 to each side. If you wanna hang out there just for a moment in that open position, here you can really see the knees coming up. Feel free to put a pillow between the knees if this is just not super comfortable right now. We're moving into a modified happy baby. The goal is to reach up to your feet, but this is a really good place to start. Opens up pelvic floor that gets so tight and relaxed. And again, grab the feet when you're ready. Just breathing in here. Every inhale, trying to get that pelvic floor to relax. And we're gonna finish with goalpost stretch. I just like you to hang out here and just try to get that back nice and flat, especially if you're a booty archer like me. Next, we're gonna move into just some simple arm slides. Again, breathing, keeping that back nice and flat, and then finish with some rotation. Should feel really good on those tight shoulders. And again, these stretches are appropriate to start from your 3 to 4 week mark, but do these throughout your postpartum recovery. These are stretches I continue to do for the first year to keep my body healthy, happy. Good job, mama.